Assalamu alaikum. This is Shama and today we're going to discuss third series of infectious diseases of gynecology. So today our topic is bacterial vaginosis. It is also called previously, but not now. It was called Gardnerella vaginitis, but now it is not called so. Why? Because we know that many other bacteria other than Gardnerella vaginitis are responsible for causing the disease. So we are now named this disease as bacterial vaginosis. Okay, now very important MCQ you can say, or for knowledge purpose it's a very important knowledge that it is the most commonest cause of abnormal vaginal discharge. It is the most common cause of abnormal vaginal discharge. Now, pathophysiology, talking about that how actually this disease occurred. What are the mechanisms of causing this disease? Fine. So, what are the mechanisms that okay, we know that normally our vagina has many bacteria in it, which we call the normal flora. So these normal flora are basically lactobacilli predominant, means lactobacilli is present in excess in these normal flora. Now what this does is that it produces of course lactic acid that keeps the pH of the vagina acidic, right, which is normal, right? But what happens if any of a predisposing factor comes and it replaces this major bacteria lactobacilli into any other polymicrobial floras? Fine, what are they? Gardnerella vaginalis, mycobacteria, mycoplasma, bacterioids, or post-streptococcus bacteria. Now these bacteria are now replaced the lactobacilli. Now what these bacteria will do, they will produce certain metabolites that will increase the pH of the vaginal tract, and it makes the pH greater than 4.5, that is alkaline, and it causes bacterial vaginosis. One other important point that these bacteria, they produce biologically active molecules which are volatile amines, and they are responsible for the fishy odor which is characteristic of this disease. Okay, so this is the whole pathophysiology. Main theme of pathophysiology, two major points: that first of all, any factor that changes the normal flora of the vagina, and as a result pH has changed from acidic to now alkaline, and that is majorly causing the disease. Just remember these 2 points. Moving on to the predisposing factors. Now the predisposing factor for this disease is first of all it's a sexually transmitted disease, one first. So all most common factor is sexually active women first of all, but yes, it's not compulsory. It can occur in lesbians also, or in virgins females, it can occur in them too. Moving on, those women which use intrauterine contraceptive devices, IUCDs, or other non-barrier methods of contraception, they are at risk of developing this disease. Then excessive washing of your vagina, like vaginal douching. It is basically if you irrigate your vagina a lot, excessive fluids are thrown over it, excessive fluid are used to wash it up. Okay, and secondly, if some women who are habitual of excessive washing their genitalia, they are at risk of developing bacterial vaginosis. Then smoking is a risk factor, and the females who are having new sexual partners, of course same the sexually active females, or who receive oral sex, so they are at risk of developing bacterial vaginosis. Plus black people, they are at risk of developing bacterial vaginosis. Moving on to the clinical features. Now, how will the patient of bacterial vaginosis present? The patient will present, first of all, the sign and symptoms will most commonly appear after menstruation or after sexual intercourse. Why? Because both of these cause pH of the vagina to become alkaline. In sexual intercourse because of semen, and in menstruation because hormonal changes occur in our body. Now, 50% of the patients, they are almost asymptomatic, but the patients or the females who are symptomatic, how will they present? Very important, discharge. I repeat, discharge. Discharge is vaginal discharge. Now it is characteristic of white color, milky, or the fishy odor containing homogeneous discharge. So this is very characteristic scenario picking points and from the history picking points. And very important, now how we'll differentiate this disease from trichomoniasis? If you remember, in trichomoniasis there was also discharge present, but what was that discharge? You should remember, I've repeated in the previous video. It is discharge that is yellowish green or brown in color, and it's frothy discharge, mucopurulent discharge, fine. But here it's this, and in that there was pruritus present of the vulva and the vagina, no pruritus here. There was dysuria, dyspareunia, no such problems are seen in bacterial vaginosis. Okay, now moving on to the speculum examination. Now if we do the speculum examination of the vagina, what we see is of course the off-white milky discharge, and it appears as if a cup of milk is poured into the vagina, is instilled into the vagina. So this is a characteristic finding. Moving on, now how we will diagnose this patient of bacterial vaginosis. First of all, just to remember the diagnosis, I have given stress when we were talking about the sign and symptoms on discharge, fine. So this discharge, just pick this word up and you'll make the whole diagnostic points, how we'll diagnose it. First of all, discharge, all the changes were occurring in the pH in this disease, so we will do the pH test of the discharge, and what it will show, it will show high pH of greater than 4.5. Second, we were talking about the fishy odor in this disease, so we go for odor test. How? We take the discharge, we mix it with 10% KOH, and then we'll see or we'll smell that there will be fishy odor. 2 points. Thirdly, we go for examinations, that we go for wet smear and see the discharge in the microscope. What we do, we see a very characteristic finding, clue cells. Now what are these clue cells? That the epithelium of the vagina, they will be covered by bacteria. So this is a characteristic finding called the clue cells. Plus we will also see some other bacteria like mobile mobiluncus. It is a genus. Now this name is very odd, so you'll get confused here. Don't get confused, it's just simple genus of gram negative anaerobic bacteria, fine. Then we go for gram staining of the discharge, and then the high vaginal swab. In gram staining, what we'll see, of course, now clue cells which were seen in the wet smear, I repeat, I just put stress on this line, they are more clearly seen in the gram staining. It's very important. Someone can ask you and you should know it. Plus, of course, since lactobacilli are being replaced, so lactobacilli and pus cells will not be seen in the gram staining. Okay, moving on to the last thing, that is high vaginal swab. Now it is misleading in this case, although in many of the infections high vaginal swab investigation plays a major role in the diagnosis, but here it is misleading. Why? Because we do the high vaginal swab and we'll see Gardnerella vaginalis even in those patients who are normal, because it is part of a normal flora also, so it's actually misleading. Now moving on to a very important diagnostic criteria that is used nowadays is that Amsel's criteria. Now this Amsel's criteria is commonly used nowadays, that any of the 4 criteria which I'm going to tell you, any of 3 out of the 4 criteria, if seen in a patient, we will label that patient as bacterial vaginosis. What are those criteria? Same we discussed before: homogeneous discharge, fishy odor of the discharge, high pH of the discharge, and clue cells in microscopy. Okay, moving on to the treatment. This is Amsel's criteria. Moving on to treatment now, same as trichomoniasis, the drug of choice is metronidazole. So you can just remember both of these brothers and sisters, they have the same drug of choice, that is metronidazole. The same dose, 2 gram, single dose. Okay, its alternate was tinidazole, but here the alternative drug is clindamycin, and it is equally effective as metronidazole. Plus a benefit, here is a benefit, that it is safe in pregnancy. We can give to the pregnant females too. Now in trichomoniasis we discussed that treatment of the male partner is necessary because it was spreading through sexual intercourse, but here the treatment of the male partner is not necessary. We just ask him that you use condoms before sexual intercourse. So yeah, this is how we proceed in the treatment. And secondly, we discussed in the start that douching and excessive washing of genitalia is a risk factor, so we'll ask the female not to do so if she is having bacterial vaginosis. Moving on to the complications now, what if we have not treated the disease, then what can happen to the patient? As I've discussed in trichomoniasis, remember, the patient become more susceptible to HIV infection. Same goes here. Secondly, we discussed their pelvic inflammatory disease can develop. Same here, that's its complication. Now to different plus we discussed there that baby birth complications occur. Same here, that preterm labor can occur, but some different points now here are these three. First of all, membranes can rupture, which can lead to miscarriage of the baby. There was no abortion as such there. And chorioamnionitis can occur here. Puerperal pyrexia can be a complication. Plus, post-operative infections can occur, like if the patient has undergone post-hysterectomy, then post-hysterectomy cellulitis can develop, vaginal cuff cellulitis. Okay, so these are all the complications of the disease. I hope you like the video. This is all about bacterial vaginosis. If you have any questions, you can ask me in the comment section. And please just like, share, and comment my video on my video. And most importantly, please just share it a lot, so that many of the other medical fellows of us, they can also have benefit. Thank you so much. Allah Hafiz. See you in the next video. Remember me in your kind prayers.